this. I interview my patients on my podcast, and they talk about, how it was difficult to um, look in the mirror, or how it was difficult afterwards. And a couple of them have been very, very poignant about, you know, making sure that they tell themselves, hey, you know, I love myself. I love myself. And that's enough. And then it's always those patients who make those comments, but also have super supportive families and spouses and partners, and they do great. But you can imagine somebody who doesn't have that support, who gets caught up in a loop where they're really down about everything, and they already didn't feel well, and then now they do a surgery that is, once again, it's not an aesthetic surgery. It's not going to make anybody look aesthetically better. And I do a bunch of fat transfers. We didn't talk about that, but another way to get breast volume is to do a fat transfer. And we do them at the same time for as many patients as we can help with at the same time. But due to, findings of, you know, uh, in their workups, we selectively offer that. But that is something that's not talked about enough as a way to perform a breast augmentation, is using a fat transfer.
Okay, so that's different than what we were talking about earlier in the show.
Yeah. Yeah.
Okay, I didn't realize that. So, let's just touch upon it really quick.
Sure.
So, fat transfer is an option for people instead of the synthetic implants.
Yeah. So basically, if you think of the people who get implants, typically they're thinner people who didn't have a lot of breast tissue. So that's the reason they got an implant. And if you are someone who's a little bit heavier and has, fat, inner outer thighs, love handles, abdomen, whatever, you can take that fat and it can be placed back in the tissues beneath the skin, but above the breast tissue, to give volume back. So there are ways to do it. People have probably heard of the Brazilian butt lift. It's not different than that. It's just you can't put as much volume in the space between the skin and the breast tissue as you can between the skin and the butt muscle, because that's a bigger area, of course. So, of course, all these things are options if, in fact, you talk to somebody who knows how to do all those different things. So I did done thousands of fat transfers for cancer patients and cosmetic patients, just like I've done over 1,000 breast reconstructions and several thousand explants because I'm old now.